Hospitals are seeing not just an uptake, but a surge in the number of patients, particularly children. What is the age group? Are they mostly kindergarten and primary school kids?
Yes, definitely there's a surge in hospitalizations of school-age children, largely because when they're in school, they're with lots of other people. It's very easy for this disease to kind of spread around. But as your report earlier reflected, the good news is that there's no evidence of a brand new pathogen. These are known and existing illnesses. Mycoplasma pneumonia, uh, flu. And so it's not actually a medical crisis right now. However, there is something of a credibility crisis. In the past, there have been two times when serious epidemics, and in one case, a pandemic, erupted in China, and the authorities were not straightforward about it. So there's always a question of whether we're getting the real story. For the moment,
That's absolutely
it
right,
seems to
Melinda.
be.
When you're talking about whether it was the outbreak of SARS in 2003 or coronavirus in 2020, China's reporting has always drawn scrutiny as well as criticism. Has there been a delay as far as reporting this time around as well?
I not not in particular because these are, as I said, existing pathogens that occur even on their own. Had there not even been COVID, there would have been some occurrence of this in the wintertime. Of course, it's more intense now because for 3 years China had some very serious zero COVID measures, mitigating factors. Everyone, were social distancing, masking, and all that. And this past year, there were no such restrictions. So people's immunity naturally was not as great as before. So that's part of the reason why we're seeing this uptick.
Right. When we talk about, is it as simple as it's being made out to be that kids who otherwise would have gotten exposed to several infections in the year didn't get sick as the lockdown continued till much later in China?
Yes, that's part of it for sure. Of course, everybody in China, when the authorities talk about disease, there is a lingering question: Are we getting the real picture?
Melinda, authorities are attributing it to a post-lockdown wave of illness, while the positivity rate is 40%. That's about 1.3 times higher than its peak in 2019. It's not entirely true that it is just, because of that extended lockdown period, which is why we're seeing that uptake and this, surge as far as cases are concerned in China.
Yeah, I mean, I think what is needed is further data from the Chinese authorities. The World Health Organization had asked Chinese officials to provide more data on this outbreak of respiratory illness, and they gave some. But we need independent confirmation that the data that was given is adequate and is a adequate reflection of what's happening on the ground. I think it's a little bit early to make a final conclusion about what's going on here. As you know, bugs, pathogens, they do mutate in real time. So by the time we get to the end of the winter, there could be a different story out there. We're in the middle of it right now.
Right, we're seeing longer queues outside the hospitals when we talk about almost 9,000 patients a day. Take us, elaborate on this particular mycoplasma pneumonia. It's known to be resistant to antibiotics. Is that the reason why we're seeing that huge number of people flocking to hospitals?
Right. I think people are very concerned and extra sensitive about illness, particularly in children, because of the COVID-19 experience. Um, um, Mycoplasma pneumonia is actually a bacterial infection. It doesn't always lead to serious cases of pneumonia. In fact, only a very small number of people with this infection actually need to be hospitalized under normal circumstances. It's often called walking pneumonia, and people have been known to just recover on their own at home. What we're getting, I think, is a little bit of oversensitivity or ultra sensitivity to, respiratory infection, signs of respiratory infection because of COVID. So parents, as at a slight fever, at a slight cough that doesn't go away, they're bringing their kids to the hospital. They want to be extra sure this isn't something fatal, this isn't something new, and everyone's just a little bit jittery. And even adults, although children are more affected, adults are also falling victim to respiratory illnesses. A lot of talks where people register to get together are seeing no shows because people
Right.
are not feeling well, that sort of thing.
Right. Thank you so much, Melinda Liu, for joining us this morning and getting us all that update.